Experts have often warned that as the coronavirus mutates and variants develop, this may lead to increased stigmatization of countries and places where they were first identified, together with their populations. Now, with variants of concern being detected in South Africa, what is the role of society in general to ensure that any sector of our population and nationalities are not vilified? Well, to discuss this further, we're joined by health activist Dr. Kgosi Letlape. He joins us now. Doctor, thank you very much indeed for your time.
Good morning to you and to the viewers.
So on the program, we are talking about stigma and discrimination directed at those who contract COVID-19. Now that we see, pictures, news reports from other countries and what people are going through there, stigma and discrimination with regards to the new variants. Your level of concern, sir?
My level of concern is about we shouldn't now discriminate. If you remember, not so long ago, there was a South African variant and South Africa was being discriminated against. We couldn't travel anywhere. We were being banned from everywhere. It's unfortunate. When a variant is discovered in a country, it just shows that that country is vigilant in terms of testing. But those variants can go elsewhere and can even start elsewhere. It does not mean if it is first detected in South Africa, that necessarily means that's the only place where that has occurred. We need to remember that this is a global pandemic. And if the world doesn't work together, the world will sink together. So we do not need to stigmatize, because it doesn't matter what the variant is. The protective measures that we have are the same, irrespective of the type of variant that we have. There's a limited number of vaccines that are available, which are sadly, for us as South Africans, they are not yet available to the general public. So we still have the same simple non-pharmaceutical measures that we need to take care of the virus and to curb the spread. And once we begin to discriminate, you let your guard off and you start fights that are unnecessary in society. Solidarity is key to dealing with the pandemic.
But why do we rush to stigmatize, to discriminate, Doctor? What's your understanding in terms of what goes on in someone's mind? Because, we're still on this learning curve, isn't it? There's still so many unknowns with regards to COVID-19. Scientists are learning about these unknowns in real time. But what goes on in someone's mind where they feel that they have to stigmatize somebody else because they contracted COVID-19?
I think it's because the way we've been socialized, and I thought it was our problem in South Africa, but it seems to be a global problem. We've been socialized to find blame. So we socialized on a blame culture. So if something happens, you need to point a finger at someone, because that absolves you of any responsibility, and that means you are okay and you found the fault. And it's the blame culture that we should be looking at. And it is the one of trying to find fault with somebody. If you remember, during the HIV pandemic, when it started, the same things happened of a blame culture. We have this tendency of wanting to deflect the problems on someone else. We like scapegoating. And we need to learn from this virus that if we scapegoat, all it does, it gives the virus ample opportunity to spread. If you look at what happened in India, they put their guard down in terms of the non-pharmaceutical methods. If any nation does that, no matter how well vaccinated you are or not, the virus will thrive. So we need to remember that we discriminate at our own peril. If we can't work together, we will never get to the bottom of this. Remember also that the infection in general is brought into families by family members. So we need to be careful in terms of the measures of physical distancing, masking, hand washing, and choosing where we go. Do not go where it is not necessary. It's still simple. Gatherings are the way the virus spreads. And I'm glad that in the sporting field, we still have the restrictions. But it's the social activities that are a menace. The parties at home, the funerals, the weddings, the religious gatherings, the sporting activities. Avoid those. If we can behave and restrict our activities for the next 12 to 24 months, we will see the virus being something of the past. But as long as we want to get back to our normal behavior in a situation that requires a different normal, we are in for a hiding. And I hope to all South Africans, as we've heard that the third wave has started in a Free State, as we've heard from Gauteng that they say they're seeing the beginnings of the third wave, with daily infections tipping over 2,000. Let us all be vigilant. Let us all be careful. It is really in our hands. In our society, less than 1% of the population has been vaccinated. So the vaccines are still not part of our fight in society. Nearly a third of the health workers have been vaccinated. So there's some protection in the front lines. But in the general population, to date, we do not have anything. In 2 weeks, it might start. But remember, a vaccine is not a magic bullet. It's just something that we add that will enable us to fight the virus better.
Doc, let me play devil's advocate. It's Mother's Day. I haven't seen my mother in months. I want to go and take my family and celebrate my mother today. Why can't I?
You know, if you keep it to the nuclear family, if there's 3 or 4 siblings with a mother, that's fine. And your cousins must be with their mother. Don't make a huge festival of bringing all the mothers together. And even in that setting, where you are a nuclear family, still take the precautions. Physically distance, wear the mask, sanitize. If anybody is symptomatic in the family, stay away from other family members. So the measures that we know still need to be applied. It does not mean you cannot see your mother. You know, the regulations under level, whatever level we are in, is the numbers, the gatherings indoors are 250. But my advice, your mother has not given birth to 250 children. So we can keep it tied to mother and the children that you've raised. Not necessarily just the biological children. We know we live in extended families, but if you are a mother and you've raised your nephews, your nieces, etc., that's your nuclear family. Keep it in the nuclear family, but uphold the methods that we know, and that will be safe. You can be with the mother in the same room.
I hear you.
You can keep 1.5 meters, but you will see your mother, you will be able to see her smile. And if everybody is protected with masks, you might even do the elbow shake. So I think we have to accept that this is a different normal. If we love our mothers, let's keep them safe by protecting them from transmission of infection. Remember, the infection is brought by the young ones to the old ones.
It's enduring the pain for now so we can celebrate. And I don't think it can be a long period of time if we just keep to the health measures, health protocols that have been put in place. We can get over this, especially with the
more we are here, the more we are here, the quicker we overcome.
I hear you. Leadership in a time of COVID. Leadership is about, among other things, consistency. It's about accountability. I will add messaging as well. With regards to social stigma, discrimination, do you think the right message is getting through or coming from our leaders with regards to COVID-19?
I think people are doing the best they can. But possibly one of the mistakes that we've made is as we go along to give the message of looking for a silver bullet. The messaging around vaccines could have been done better, where we could have clearly articulated to people that this is additional protection. This is not a substitute to get rid of non-pharmaceutical methods. We should have made people understand that curbing the infection is not in the hands of authorities. It is in the hands of the citizens. We transmit the virus from person to person. We become the vectors of the virus, not the leaders, not the state. And I think that message has been lost from leadership. To say, let's keep doing the simple things. Let me not say that it's been lost, but it's not been emphasized as diligently as it should have been. These personal measures, I'm an advocate for hand washing, even pre-COVID. This should be what we do as second nature.
Yes.
Improved hygiene should be what we do even in the absence of COVID, so that we can curb the spread of infectious diseases and we can control the resistance of pathogens to the antimicrobials that we have.
Yes.
So I think what we need to do is to lose this attitude of looking to be saved by the leaders or the state. The spread is in families. So leadership has to arise inside families. Let the head of the household be the leader. Let the educated child that comes from school, that's been informed about COVID, be the leader in the house. Remember, when we have measures like hand washing, the ambassadors become the children. When we have things like brushing your teeth, when kids are taught at school, they bring it to the house. All of us have to assume a leadership role if we are going to curb the pandemic.
Yeah.
We cannot leave it up to those that have been put in position. All of us should take responsibility and all of us should lead, and we should stop abdicating and hoping for magic bullets for those in power.
Yeah.
Let the power get back to the people, and if we as the people take responsibility, the virus has nowhere to go.
Prevention is so important. Why? Then you don't have to deal with the unknown. And what you're doing, Dr. Letlape, is pulling back the curtain and giving us a window into what people are thinking currently and the challenges that they are going through. And we thank you very much indeed, sir, for your time and expertise on this matter. Be well.
Yeah, thank you. Like you said, prevention is priceless.
Yeah.
Cure is unaffordable.
100%. That was a health activist, Dr. Kgosi Letlape, there, giving us a sense of what we're dealing with currently in South Africa, the variants that are coming into this country. The language that we use is so important in order to avoid stigmatization, in order to avoid discrimination.